Hey guys, it's Carlos from Spark. I had a question from a training partner a little while ago. I gave him some advice on the mat on how to handle this injury, and I figured there are a lot of jiu-jitsu players and grapplers who might be struggling with the same thing. It's a strain or an injury of the triangular fibrocartilage complex, or in physical therapy terms, just this TFCC. I could bore you with all the multisyllabic words that describe the bones, but for right now, it's where the end of this wrist bone meets the wrist bones of the carpals, or the smaller bones here. So it's a bit of cartilage that when it gets injured, it can be injured in sort of this plane where our wrist is all ulnarly flexed, and we rotate it in such a way where you could cause an actual tear to that cartilage or a strain. And the best way that we can address this conservatively is to form a little bit of a block. We are going to use a taping technique. It's very, very simple. I want to walk you through it, and you guys just have fun with it. So what I did is I created a little bit of a roll of tape. I took just about 12 inches worth of athletic tape, and I just rolled it up on itself. And so for the sake of everybody watching, that's awful, but this is what you want it to look like. I like having it inside out as well because it allows me to place it right where the ulna and those wrist bones meet. So I can actually give myself some ulnar deviation. And now what I'm going to do is I'm going to lock it in. So I've prepared some other strips of tape. We've shown other taping techniques where, again, we want to make sure we're placing tape firmly, but not with a lot of tension here. I'm going to push it down, and I'm going to just lock this guy in place. Now, that's not the one that's going to hold us down. Okay, the next two strips of tape really are going to do a much better job of that. So this one just keeps that all in place, and then I'm going to grab the other set. Now from here, because I'm taping tape to tape, I can add quite a bit of tension across. Okay, so now when I lay tape down, it really starts to press this little wedge right where that triangular fiber cartilage wants to push out. Okay, I can add another one. And I could definitely do this much more neatly, but you guys get the idea. Here, number one, you're going to get a little bit less ulnar deviation, okay, which is going to protect that area, but it's also going to provide some compression to allow that healing structure to just knit up nice, allow you to keep training, and limit some of the pain that you might be experiencing. So this is for TFCC injuries. There's a lot of little doohickeys you can buy, but this is the easiest, probably one of the most elegant ways to treat it yourself and stay on the mat.